Hi there, Hayley from Foundation Podiatry. So just continuing on with our forefoot pain series, today's topic is Hallux Limitus. So hallux is the big toe and limitus is limited movement. So ideally with walking and running, we need 65 degrees of bending at the big toe joint, okay? Now, when this range becomes limited, it's what we call Hallux Limitus, and that can be for different reasons. So a common one is that the first metatarsal is longer than the second metatarsal, okay? So as we're walking, that gets jammed up, and with time, it can become an arthritic condition. Okay, so the difference with Hallux Limitus is the arthritic condition, so the bony bump is on the top of the joint, which blocks that big toe bending. Whereas Hallux valgus, or the bunion deformity, generally the bony bump is off to the side of the toe joint, which ends up pushing the toe to the side, okay? So Hallux Limitus is a little bit different and needs to be managed differently. Now, as the joint becomes more and more arthritic and the range of motion becomes less, we then call it Hallux Rigidus, and again, that needs to be managed differently. So in acute cases of Hallux Limitus, so it may be if you've jammed your toe and it's really flared up, so turf toe, we would tape the toe to stiffen it up to calm the joint down, and that can be really effective. We may also do things like needling and laser to calm it down, okay? If the range of motion is a little bit limited and not super arthritic, then ideally we can try to improve that range of motion through joint mobilization and different exercises, okay? But sometimes it gets to a point where the toe joint, so the joint space is narrowed and the bony bump on the top is too much, that trying to improve that range of motion is no longer possible. And in that case, we would then actually try and permanently stiffen up the big toe through using a type of orthotic that does that. So as with most things, the earlier we get to address it and see it, the better outcome. But there can be still lots of things that we can do to help. Now, when Hallux Limitus does become super painful and more arthritic, that may be when a referral to a surgeon is needed. So that's another forefoot topic. As you can see, the forefoot can be quite complex. If you have any issues, come and have a chat with us. Thank you.